Greetings everyone. My name is Jacqueline Hermione.
My name is Cecilia Tiffany.
And my name is James Jackson. We are from Santa Laurencia Senior High School, representing Indonesia.
In this opportunity, we would like to present our research entitled Site-Directed Mutagenesis of Factor VIII Protein for Hemophilia A patients with Alloantibodies.
Hemophilia is a disorder in which blood doesn't clot normally, leading to extensive bleeding. According to CDC, hemophilia type A is the most common type, with 10 in 100,000 people having hemophilia type A globally. However, 40 to 60% of hemophilia A patients develop an alloantibody, which makes the current treatment of cryoprecipitate transfusion ineffective. In addition, the current treatment itself is also in limited supply. This became a rising problem as the life expectancy of patients that do not receive proper treatment would decrease by 20 to 21 years. The objective of this research is to develop a remodeled factor VIII protein that can develop as a treatment for hemophilia type A patients with alloantibodies. The steps of our research began by collecting the data of protein with PDB. Then, the modification of protein through Discovery Studio Visualizer with site-directed mutagenesis. Then, the protein is remodeled with Swiss model. Molecular dynamic simulation was then conducted towards the mutant protein, and a trajectory analysis of Ramachandran plot, isotropic displacement, and local quality estimate was also conducted. This research remodeled the protein by alanine scanning method, as this method takes advantage of the fact that the most canonical amino acids can be exchanged with alanine by point mutations, while the secondary structure of the mutated protein remains intact. Therefore, by substituting these specific residues with alanine, the mutant protein will lose the residue that is able to form direct contacts with alloantibodies and able to function as blood coagulation without the inhibition of the alloantibodies.
Isotropic displacement talks about the mean displacement of an atom from its mean position in a crystal. In theory, a low isotropic displacement shows a rigid protein structure as there is minimal movement of the atoms. According to the graph, the mutant protein showed significantly lower isotropic displacement as each amino acid residue does not exceed 1 angstrom square, with the highest value at alanine 1154. Therefore, this shows that the mutant protein is more rigid than the wild protein. The root mean square deviation, or RMSD, compares the conformational changes of molecules, where in theory, a low RMSD value corresponds to a stable molecule. According to the graph showing this result, wild protein and mutant protein show similar stability as they have similar RMSD values. Further evaluations of RMSD can be done through root mean square fluctuation, or RMSF, as this value compares the fluctuation in each amino acid residue. In theory, high RMSF value shows high fluctuation in that amino acid residue. Therefore, referring to the graph, wild protein tends to fluctuate more than the mutant protein. As a complement to previous data, binding energy of the protein based on molecular dynamics is also evaluated. In this context, a more negative binding energy shows that the protein is more stable, as it requires more energy to separate them. In this research, stability of protein is important, as the mutant protein should be able to still maintain stability and function, likewise of the wild type, even with the change in amino acid residue.
Next, a Ramachandran plot analysis is also conducted to assess the accuracy and stereochemical properties of the protein prototype. In summary, over 80% of amino acid residues, specifically 97.8%, are positioned in the favored and allowed regions, indicating the direct usability of the protein prototype. Lastly, a local quality estimate analysis is performed to assess the similarity between the mutant and wild-type proteins at each amino acid residue. The predicted mean value is approximately 0.71, indicating an overall similarity between the mutant and the wild-type proteins.
The future work of this research is that the in silico study can be used as an initial dataset for further trials in vitro, in vivo, and clinical trials. Furthermore, the potential application of this research is that it could be used as gene therapy and replacement therapy for hemophilia A patients who develop alloantibodies.
Thank you for listening to our presentation. Best regards from Indonesia.